Welcome to the Renegade Health Boss podcast, where we push the boundaries of what's possible in health and wellness. I'm your host, Heather Gray, a certified functional diagnostic nutrition practitioner and certified bioenergetic practitioner. And each week we dive deep into the world of physical, mental, spiritual health, biohacking, relationships. But we're not just talking about the basics. I'm bringing you conversations with the true renegades, experts who are challenging the status quo in their fields, breaking barriers, and uncovering the real truth behind what it takes to live an incredible, joy-filled, and optimized life. If you're ready to step out of the ordinary and step into a life of extraordinary health and happiness, you're in the right place. Let's get started on this journey to becoming your own Renegade Health Boss. And before we jump in, let's hear a word from our sponsor.
Dr. Nathan Bryan here with our N101 nitric oxide orally disintegrating tablet. You know, nitric oxide is a gas, so how do we deliver a bioactive gas in a solid dose form? We've created a solid dose form of bioactive gas. This lozenge, which is designed to have a resident time of 5 to 6 minutes. So you take this lozenge, you put it in your mouth, don't chew it, don't swallow it. Let it dissolve. As it's dissolving, it's releasing a certain amount of nitric oxide over a certain period of time. And that release of nitric oxide is designed to recapitulate nitric oxide production and nitric oxide signaling. So if your body can't make nitric oxide for whatever reason, this product delivers it for you. But more importantly, the technology in this lozenge recouples the NOS enzyme, so we improve endothelial function. We improve the body's ability to make nitric oxide on its own. And because it's an orally disintegrating tablet that sits on the top of the tongue and moves around, it's killing the bad bacteria. It's maintaining the diversity of the oral microbiome. We're improving the nitrate-reducing bacteria, so we're improving the oral microbiome. So this product generates nitric oxide and improves the body's ability to make nitric oxide through both pathways, endothelial nitric oxide production through restoration of the oral microbiome. There's no other product on the market that does what this product does. This is an orally disintegrating tablet that releases nitric oxide. We can quantify it, we can detect it, we can verify it. So if your body can't make nitric oxide, we do it for you. N101 activating lozenges. Get it today.
Yay! Welcome, Claudia, to the show. Thank you for joining us.
Well, thank you, Heather, for having me. I'm super excited about this interview today.
Absolutely. And I appreciate your patience. I know there's been a couple rough starts. You know, I had a rough couple of months with mold and a bunch of other things that kind of, can sideswipe you. So I so appreciate your patience and sticking with this. And I'm so excited to get to talk to you today. You're one of the few, I wouldn't say few, I fall in love with a lot of the Mindshare folks, but you, like right off the bat, the first time I went 4 years ago, you're just big smiley face. You're just very warm and playful. And I was like, should I join Mindshare? And you were like, absolutely, yes, you run, do it now. You know, it was one of the best things that you said you've ever done. So I was just so excited to be around someone like you. You've just got such a beautiful, amazing energy. So thank you.
Thank you.
Absolutely. I love the topic of eyesight, vision. We're going to cover all kinds of things. What's the difference? How can you do it naturally? Can you correct it naturally? But before we get into that, tell us a little bit about yourself and your journey and how you got started and all this.
So like many of us that are helping others improve their health, in my case, I had glasses and I got glasses at the age of 3. I was farsighted. I had a convergent squint, meaning my right eye would turn in, and astigmatism. And I was born in the 60s. I'm still, and back then nobody wore glasses. So when I got to school, there was one other boy I remember in 2nd grade, but he was the professor. He was like, yeah, I know the answer. And I was sitting there like studying really hard, and I really struggled in school, and I got bullied and teased. And years later, I discovered by accident, because I joined a handball team. And the reason why is because they were desperate. In my little town, we didn't have many players. And I was not I couldn't catch the ball. It would hit me in the face. Like,
oh, no.
But then the coach said, you can't wear your glasses, right? Because they were glass.
So,
and like, now I know movement, peripheral vision, sunlight, catching and throwing, all this stuff. The doctor said, your eyes are normal. I was like, oh my God, beautiful. Boys would be like, you have beautiful eyes. And I was like, what? Me, the 4-eyed? But a couple of years later, studying for high school exams, like stress, right? Again, not good in school, lots of near work. My vision got blurry again. And at that point, I was like, screw this, fuck it. I was determined to go and do something about it, even though everybody thought, like, this is crazy, Claudia. You know that you can't do anything about your vision, right? I found one book. I searched all the bookstores in my hometown in Germany, found one book, and that got me started. And I don't want to tell the whole story, but I was out of glasses in my 20s, back in glasses in my 30s, difficult marriage. Few years into that, again, that same epiphany where I'm like, I noticed, here's the thing that I noticed. The big thing that got me. So I wore the glasses. I was driving, I had a very stressful day, got home really late. And every time when I took my glasses off, my vision was so blurry. In that particular night, it was very blurry, like to the point where it scared me. And like, how is this if it's correcting, like, how does it make it worse? Like, because my vision was a little blurry before I put them on, but afterwards it was like really bad. And I'm like, that doesn't feel right. And then I really got into that. Was in my early 40s.
Isn't that fascinating? Like we had talked when you had me on your show, how I've noticed, because I started wearing glasses when I was 7, right? And then I had LASIK done in my early 20s. Hindsight's 2020. Haha, I wouldn't have done that now if I knew what I know, then. But it's fascinating when I'm having issues with mold or when I'm having issues with Lyme or like you said, stress, or I recently found out in my genes, I actually don't process salt really well. So I actually have a salt sensitivity. So if I eat out at a restaurant, like all these things, I will notice the next day, it greatly affects my vision. And so how funny is that we slap these things on thinking it's, going to help for the long term when really we need to be looking at the root cause of kind of what's causing this inflammation, why this, lowering your stress, all the things I'm sure we're going to talk about. But I just recently put 2 and 2 together myself. Like I never noticed that my vision fluctuated.
But you know what I call this? I always say blurry vision is the engine light coming on because it's telling you something isn't right. It's not all of a sudden your eyeball is misshapen or misformed or whatever, or the cornea is bent out of shape, whatever they tell you. So you're absolutely right? You notice that with mold and Lyme, and like when we become more tuned in, and that's the problem when we wear these crutches all the time, we might not notice those little fluctuations, right? But when we take them off more often, we might notice, like you said, or maybe in the morning your vision is better and in the afternoon it's worse, or, like different lighting, like different things that you're doing, maybe in nature you feel like your vision is relaxed and clear. And when you do things you hate doing, so tuning into those fluctuations, which are absolutely normal.
That's absolutely incredible. This is a great spot. We're going to pause real quick. When we come back, I want to dive deeper into what's the difference between vision and eyesight, and can you actually correct these things? And then I also know that you've got a 5-day, challenge coming up. And so we're going to dive deeper into all those things. I can't wait. So stay tuned. Don't go anywhere. Hey there. I used to not be able to drink coffee. I always reacted to it horribly. It hurt my stomach. It made me over jittery and would inflame me and cause histamine issues. But not anymore. Now that since I started drinking Danger Coffee by Dave Asprey, it's his next level of coffees. He came out with Bulletproof, and now this is the next level up. So it is mold-free, toxin-free, and he infuses it with minerals and electrolytes. So unlike other coffees, they can actually pull minerals and electrolytes from your system because it's too acidic. It actually helps replenish those. And so I don't react to it at all. I get to have my Bulletproof coffee with my MCC oil and my grass-fed butter, and I don't get the jitters, I don't get the crashes, and I love how focused and energized it makes me feel. Again, non-toxic, mold-free, infused with minerals and electrolytes. I absolutely love Danger Coffee. Make sure to check out my website, thelyboss.com. Go to the resource section and get yours. Fantastic. Welcome back. Super excited. So let's dive into what is the difference between vision and eyesight? So eyesight is honestly what we call visual acuity. So if you've ever went to an eye doctor, they measured your vision on an eye chart, right? That's visual acuity, 2020. When we talk about 2020, 2010, all that kind of stuff, that is eyesight, how sharp you can see. Now, vision is night vision, binocular vision. How do your eyes work together? It's peripheral vision, it's color vision, and it's also, we talk about our vision for our life, right? We talk about our vision for our company. So vision is a way bigger way to look at this, and that's what I do. And that doesn't mean that we don't look at eyesight. Obviously, that's an important piece of it, but that's so limiting. That's fascinating. I never would have thought about that. So what are some of the beginning steps of somebody who, wants to look at correcting their vision? And is there ever a point where it's too late? Like somebody like me who's had LASIK done, or somebody who's, worn glasses or contacts for 30 some years. Like, is there hope for someone like me?
There's always hope, but I do want to address the term correct, because I do not like that term so much, because it's that idea. That's why you got LASIK. It's like, fixing something, right? It's like when we think about our like strength, right? We wouldn't say I correct my strength. I fix my strengths. I go to the gym for 4 weeks, work out like crazy, and then I'm done. And when we break a bone, we talk about correcting the bone, but the bone is actually broken. You get the cast, and then it grows together. You get physical therapy, and you do, flexibility work, all those kind of things. So you could say the bone is corrected in a way that it's like it's not broken, right? But then if you have osteoporosis later in life, or you fall, like there's other things that can happen. We already talked about vision, right? And we talked about how vision fluctuates. Now, the baseline of your vision will be very different from somebody who can barely see versus somebody who has amazing clear eyesight, right? But even when my vision is really great, but when I'm stressed, whatever happens, an accident, my vision will be blurry. So I know that because I'm in that high stress level mode, in that sympathetic nervous system mode, fight or flight, pupils dilate, peripheral vision shuts down. You know all the process. I'm sure your listeners know all this stuff. So then I could say, well, my vision is really bad. If I go for an eye exam, by the way, which is never relaxing, an eye exam is one of the most stressful things, then my vision will never be optimal at that moment. There will always be a little bit of a, even if it's a quarter diopter, and that's why so many people get their glasses from the eye doctor. They get, he fills a prescription, you get them and you put them on, you're like, holy smokes, this is like so strong, because you were caught at your worst moment. So I want to really clearly say that, because there is not like from perfect vision to -5 diopters, but there is fluctuation. And one other thing I want to say before we get to the if it's too late point, they did studies with people that have dissociative identity disorder, which used to be called multiple personality disorders.
Ooh, I think I know where you're going with this. I've already got goosebumps.
And these people have different alters or personas, and they looked at the vision of these people in different personas. There used to be a great TV show, The United States of Tara. I love that show. And in one of her personas, she was a guy. And back then, I didn't really know that. I hadn't learned all these things, right? And I was always wondering, why does she wear glasses as Bud, right? The guy with the overalls versus. So they found in these studies that in these different personas, now we're talking about exactly the same body, they could be very nearsighted. They could have eagle eye vision in another one. Their color perception was different. The pupil size, the intraocular eye pressure was different. So now you're thinking, wait a moment, like, how is that possible, right? So, but to answer your question, what I say, we can always make improvements. We can always make improvements. Does everybody, like if you're 80 years old, you have eye diseases, you get back to like perfect vision? No, but we can make improvements. And that is like, instead of waiting for the verdict from the eye doctor and be like, oh, it's another thing, let's wait and see, there's nothing we can do. Everybody has it in their own hands and eyes, how well they see into old age.
I love that you brought up that study, because that was the other thing that I learned, is that some of them will have, one personality will have diabetes and the other one won't.
Yeah.
Like, how fascinating is the body?
I know.
Oh
and
my gosh.
Brain where we actually see.
Absolutely fascinating. I've had, like I said, so I had LASIK done in my mid-20s, and they told me in my 40s, you're going to need readers, right? Like these flat said that. And me being the little asshole that I am, I'm like, watch me. I'm almost 47 now, and the only time I need readers is to read a really small pill bottle. That's it. Otherwise, I don't need glasses. I don't need readers, because I've been doing these different exercises. I've learned to keep my inflammation and my other stuff down. So what are some of the top causes that will injure a person's eyesight, or, not make it as great, make it blurry? What are some of the top causes for that?
So you brought up a thing that you might need reading glasses. So if you didn't have LASIK, you are probably totally fine reading small print up close without any correction. But now the contact lens, or whatever your prescription was, the strength of your nearsightedness is kind of engraved in your cornea. So now, but this is something that people don't know. diopters only work for a specific distance. So you got corrected for far vision. Now that was never, even like when you were 20, was never the same that you needed for near vision. In fact, you probably didn't need anything to read, right? So now that's on your eye, it's almost like you can't, the only reason you need reading glasses is because you really never need that full strength of minus for reading. It's like, this was never the case. So reasons could be many. I mean, we talked about stress already, right? A lot of times when I talk to my clients, there's some kind of stress. It could be trauma as a child. It could be emotional. It could be physical, adverse childhood events. Or I had a client, she was a pharmacist and she worked in a pharmacy in her 40s. They got computers when she was in her 40s. And she was really good at doing all the paper stuff. All of a sudden, there's like the stress, like, oh, I don't know how this computer works. So it could be a job you don't like. It could be a difficult marriage that's falling apart. So somehow, it could be all these underlying other health conditions, right? Like diabetes, we talked about Lyme, mold, thyroid. There's so many other health conditions that could make your vision worse. Eye doctors usually say it's genetic, and they say once you get into your 40s, presbyopia. Presbyopia is that old age site where people start losing some of their near vision. Now, a lot of people do not lose their near vision. So I think it's common, but it doesn't mean it's normal. And one thing that when you get older, and I don't know if you can relate to this, I'm now in my 60s, but there's all this stuff where also to a certain degree, you don't want to deal with all the things, right? You just want to delegate or like do the fun. Like sometimes there's this personality thing, and I'm a farsighted person, right? I was farsighted as a child. You were nearsighted. Farsighted people in general, like, are more out there and do the stuff, and they have trouble like looking at themselves. So sometimes I feel like as we get older, we might also push things away from us a little bit, get a little more grumpy. Are there changes in the eyes? Are there changes in the brain? Yes. I mean, we get more wrinkles, but it doesn't mean that we can't do something about it, right? It's like eye doctors say, oh, you're mid-60s, you cataract, that's totally normal. No, it's not normal, right? So we have a lot of control over this. But yeah, our bodies age, our brain age. I mean, we know that, right? I mean, that would be stupid to say this doesn't happen, but it doesn't mean that you're doomed to like lose all your near vision.
That's incredible. Yeah, I feel like it's kind of breathing down my neck, and I feel like it's a daily thing, but it's no different than my daily exercises or brushing my teeth daily or meditating daily. So it's just part of what it takes to keep me, a whole healthy person.
Right, exactly.
What about astigmatism?
So astigmatism, it's like I always have my little plastic eyeballs here. So astigmatism, here's one thing, like for those of you listening and not seeing it, if you're nearsighted, your eyeball is a little elongated, like an oval. And if you're farsighted, like your eyeball is a little short, like more like a vertical oval, right? Now we have 6 outer eye muscles. So there's 6 very strong muscles around the eyeball. I only have 5 fingers, but imagine there's 6. Some of these muscles, and that's the case, are more tight. Then when you push on that eyeball, the eyeball is very soft and squishy. If you've ever dissected cow's eyes in high school, I actually refuse to do that. But they're very soft and the muscles are strong. So if now some of the muscles are more tight, that will also, the cornea is an extension of the eyeball, right? It's like it's a clear extension of the white part, the sclera of the eyeball. Now that will also distort the cornea. So the basically astigmatism is, for lack of better way of explaining it, a lot of times eye doctors even say it's like an American football. But imagine that instead of a perfect dome shape of your cornea, it's like there's a flatter curve and there's a steeper curve. So because of some of these muscles pulling unevenly, that's usually what we find is the main cause. And there's a postural component. And this was actually research done by an optometrist named Elliot Forrest in the 80s, and nobody talks about it. But he observed thousands of his patients, and he would always write down like their numbers, what he measured, and then like suddenly, let's say they had an astigmatism, he would be like, "What changed? Your job?" And he meticulously put together certain postural components: how we move our head, do we have a tilt, do we have a rotation, do we habitually look to our left side? They're found in music, orchestra musicians. Like if you're always on the left side of the music stand in the orchestra, or if you play a violin and your head is not straight, or a trombone, there's always the same level of astigmatism that can be found in the eye. So and Louise Hay, I love Louise Hay. She said about the emotional level, there's a fear of seeing I myself, like you basically feel like you have to play roles to be accepted. So I always like to talk about the physical, mental, emotional, and maybe spiritual level too of these things. So fear of like myself, like, when have you ever felt you have to play a role, like, right? Who didn't, in a way, right? That's why,
Especially women. Like, my God, no, don't be big. Don't
yeah,
fuss. That's not
yeah.
ladylike. You're supposed to be seen and
Uh-huh.
not heard. Yeah, no. Bah, bleh.
So yeah, there's many levels to this, and also I find, and I had really bad astigmatism in my right eye. It's like it flares up sometimes, but it's also connected to. So astigmatism means you have different focal points, not just one that's in front or behind the retina, but you have different ones. So think a little bit of like this ADD behavior, like not being able to focus on one thing, like constantly. And I definitely had struggled with that. And I don't have that's not about the clinical diagnosis, but that, like, I see my sister, she does one thing and then for 2 hours and then she does the next thing. And I'm like, oh, wait, oh no, let's see. Oh God, I have to do this. It's like, that is
World.
definitely also an aspect of that astigmatic behavior.
Huh, fascinating. My son has a pretty bad astigmatism and he's had it for quite some years and it's starting to affect his night vision. And so I was looking forward to this conversation because I was like, gosh, I wonder if there's something more. He doesn't quite believe in the same stuff that I do, though. So I'm not
Yeah.
sure I can get him
But
on board.
look at posture. So, sometimes people have especially
Oh,
that's,
his posture sucks.
yeah, like, but how you, like, people have progressive glasses on and now the lower part of the glasses is for near vision and they sit in front of a computer like this. That will always result in astigmatism. And I can look at the axis, the angle of the astigmatism, and which eye is stronger. Like sometimes a right-handed person that does a lot of things on the right side, they might have a stronger cylinder in the left eye. And that means because the left eye is always further away from the focal point. So of course we can have our eyes look at all the directions, but if we habitually, and that's what Elliot Forrest discovered, if we habitually do the same things over and over and over again, if we always move our eyes without our head, of course we can do it, right? But if we do the same thing all the time, certain muscles get stronger and other muscles lose some ability. So that is a contributing factor of astigmatism for sure.
Totally makes sense. And I love the fact that you brought up the mental emotional because I was going to ask that because, being the functional practitioner that I am, I was really great at focusing on the body, but I didn't focus on the other stuff, right? And I'd keep relapsing. And it wasn't until I started, putting the whole person together is when I started to heal. And like right now I'm dealing with some plantar fasciitis. And when I look up mental emotional, it's like having a hard time moving forward, into the future, and I'm kind of in this weird position right now. It's like, what do I want to be when I grow up? So it's fascinating to me. So the whole vision thing, not, being seen, like that totally makes sense.
Yeah, I always, when I work with clients, and there is some things, sometimes the emotional stuff, we don't start with that because, like, if I would do my marketing with like, you're and cover like nobody would do it, right? Everybody wants 20/20 vision. And we obviously address that too. But the inner work, sometimes it takes, a little bit of time to connect to that. And I always make a suggestion of like what that could be. And people are either like, oh yeah, that makes total sense. And sometimes not, but I don't say that everybody that has astigmatism is an ADD personality kind of style, right? But more often than not, we find that's the case, right? But it doesn't mean even Elliot Forrest said 85% of the cases he could connect it to postural behaviors, how move the head, the eyes, and all that. But not every single scenario is like that, right? So I think we also have to be open-minded and not think that it's always exactly this way or that way.
Fascinating. So, as we're kind of getting closer to the end here, could you leave us with one or two kind of tidbits to kind of help us moving in the right direction? And then I know you've got a 5-day challenge coming up. I'd like to talk a little bit about that as well.
Yeah, I mean, I think the one thing, what I call strains and gains, right? Which is what I said, like notice when your vision is better, when it is worse. That will already give you clues. I always give an example that I had, when I would do like these kind of things, my vision was super clear when I was meeting friends. But then I would look at bookkeeping or Excel spreadsheets, which is totally my vision, because I hated doing that task. I had a client who said her vision gets blurry when she goes into the garden. I'm like, oh, really? Because garden, most of the time people are like, that's a gain. I like going. She said, I see all the weeds and all the work. And so for her, that was a strain. So that's one thing you can do. Notice how small the area, this is another thing we haven't talked about, but anatomically, the area of perfectly sharp vision, you might have heard of macular degeneration, right? Inside the macula is the fovea, which is a tiny, tiny, tiny spot in the retina. That's why we have perfect vision. So when you look at my right eye, or I look at anything, look at one object, and notice that everything else doesn't look as good. Like if you want to see the left eye, you have to shift your attention to the left eye. So we see this big peripheral field, right, which is great, but our sharp vision is very, very small. And so people with poor vision habits, especially when you wear glasses, you have this habit of staring, right, where you're like, I want to see everything clear at the same time, which is anatomically impossible. So that's something. And take your glasses off is another thing. Take your glasses off not when you're driving, obviously, but when it's safe to do so. Just like walking in the dark, we can practice on night vision, not always immediately putting the flashlight on or the light switch on. Maybe just walk around the house, accept a little bit of that blur, and notice all the things that you do see. One tip I give there is pick a color. Doesn't matter. Pick a color right now, Heather. Pick a color. Green. Okay, great. I pick a red. And then look around you and without, even if it's blurry, but notice all the things you notice in that color. This is great when you're a passenger in the car, even when you're driving. Of course, you focus on the road, but when you are walking on hikes, you all of a sudden you're like, wow, I never noticed that green house over there. And it's not about seeing, you might not even know what the thing is, but you notice the color. And great thing to play with kids too, by the way, like that game, I spy something orange, and if it's this time of the year, it might be likely a pumpkin, but maybe if it's another time of the year, maybe it's a balloon or something. You don't really need to know what it is, but you're focusing on what you can see.
Absolutely. And it's just like you said, it's like a muscle. I remember I just recently started doing stand-up comedy and it's putting me out at night more, which kind of pisses me off because I kind of like to be in bed by a certain time. But I was noticing in the beginning of a couple months ago, my night vision was horrible. And I was like, oh God, this is a little scary. And then I kind of, over time, just really was working my eyes and being at night more. I drive home just fine now with no issues. And that was just in like 3 months time. Like that's how fast it turned around.
Exactly. It's like sometimes, yeah, we are like scared of doing little things and really trusting it takes your eyes at night. It takes your eyes quite a while. The rod cells, which are the night vision cells, it takes them a while. If you've ever been in a pitch black dark room, you switch the light off and everything is dark, and then slowly you see more and more things because it takes these cells up to 30 minutes to fully develop their hyper light sensitivity and really see all the details. So we have to sometimes be a little bit patient and trust our body's ability to also, when we walk, right? When we walk, we are not going to be likely to fall immediately, but sometimes we are so scared of our proprioception where we are in space that we are like immediately like, oh, light, right? We can't. Yeah. So obviously saying that you're in a safe environment, I don't want
exactly.
Obviously common sense, right?
Absolutely. 110%. No getting into car accidents and blaming Heather.
No, not for driving. Let's not mess with that. Yeah.
So what's your 5-day challenge coming up?
So it's called See Better in Just 5 Days. And I always say that don't believe me. Don't believe your eye doctor. See for yourself that you can make improvements in just 5 days. And yeah, we're starting on January 13th. It's a completely free event. All the little daily trainings are super short, 2 to 3 minutes, and the practices are even shorter that I recommend. So you can pre-watch them. We give you one at each day, and then we do daily life coaching, and we have prizes, and yeah, it's really fun.
I'm super excited. I have not been able to join one in the past, but this one, I've got nothing else going on. So I'm actually going to block out my schedule and I'm going to join this one because it is, getting older. It is something that, I'm paying more attention to. And I wouldn't call it vanity, but I don't want to wear glasses. I just don't want to wear glasses. I know there's an option and I really enjoy living a glass-free life and I want to keep that as long as possible.
I agree. I mean, vanity is first of all, glasses age you, right? Who wants to look older? And for me, it's also about freedom, right? Because I heard from clients, I forgot these at home. I can't drive anywhere, or I'm lost, so I can't read anything. And I want freedom, right? To do whatever I want and not be handicapped by my vision. So, yeah.
Freedom! Fantastic. Well, thank you again so much for joining me today. Like, I knew we were going to have a blast, and just appreciate everything you're doing in the world. Everybody else, make sure to have a healthy day. Thanks again. If you learned anything, even one little nugget in any episode, please do not keep us a secret. Like, share, subscribe, and leave a review on Apple, on Spotify. That is how we get this information out there, and we change this paradigm one person at a time. I can't do it by myself. I need your help. Also, make sure to know that disclaimer, anything that you hear on this, you cannot hold Discovering Health LLC, Renegade Health Boss, The Line Boss, Heather Gray, liable for anything. Always consult your doctor before doing anything new. Do not take this as medical advice. This is your disclaimer. And then also, if you want to know the foundations of health, right? All that I talk about on how I get healthy, the absolute foundations: sleep, diet, exercise, what to eat, toxins, how to detox mold, all of it. You can get it in your own course at rhbcourses.com, right? Start your healing journey today, as little as $79. Start today, rhbcourses.com. Stay tuned, and thanks for joining us.